In this morning's Health Watch, a new study finds that a broken heart doesn't just hurt, it can actually kill you. Medical correspondent Dr. Jon LaPook is here. Good morning.
Good morning. How you doing, Charlie?
So what does this show us?
Well, we've known that emotions can affect the body, right? And this study shows that people who have lost a significant person are 21 times more likely to have a heart attack within the next 24 hours. That's really very impressive.
What is it about that time frame or that connection?
Yeah, well, you know, there are things like adrenaline, which can close down the heart vessels and make you have too little blood flow to the heart. Your blood pressure can go up, your pulse can go up, and also, very interestingly, the hormones can make your blood more sticky and have more chance of getting a heart attack.
Yesterday I asked you about a question of risk, and you're here to sort of elaborate on what we said.
Yes, well, you know, the current state of the art here is that people who are at low risk of having a heart attack probably shouldn't take an aspirin to prevent a heart attack because of the risks of taking an aspirin, like bleeding and ulceration, for example. On the other hand, people who are at high risk, people who have had a heart attack, for example, probably should take an aspirin. Now, after the broadcast yesterday, we discussed all that. I'm looking at the tape, and I said, at the very, very end, I said, people who have had a heart attack, for people who have had a heart attack, the risk probably outweighs the benefit, which is exactly the opposite of what I meant to say. For people who have had a heart attack, to be clear, for people who have had a heart attack, the benefit of taking aspirin probably outweighs the risk. But as always, you should always check with your doctor, and doctors actually have a way of calculating your risk, putting in all your risk factors, blood pressure, pulse, cholesterol, all those things, and coming up with a number. So you should go to your doctor and say, what's my risk factor? Should I be taking an aspirin? Because that, at the end of the day, that's what people want to know.
Not bad advice on anything.
No, it isn't. Jon, always nice to have you with us.
Thank you very much.
Dr. Jon LaPook, thanks.